Hello, my name is Kelly Briggs, and I'm a Maryville University nurse practitioner student, and this is my head, eyes, ears, nose, and throat video. This is my patient David. He's a 34-year-old male. The first thing that we want to assess in the patient is his visual acuity, which assesses cranial nerves number 2. We can use a Snell and eye chart for distant vision and a Rosenbaum pocket chart for near vision. The next test that we're going to perform is his peripheral vision, which is a confrontation test. If you could cover your left eye, please. All right, I'm going to cover my right. Look directly at me and let me know when you can no longer, or when you see my fingers wiggling.
No.
All right, great. The next test that we're going to perform on the patient is we're going to assess his orbital area, noting that his eyebrows are nice and full and they extend all the way to the temporal canthus, and there's no crusting or swelling present. Is there any pain or tenderness noted?
No.
All right. And then we want to inspect and palpate his orbital area, noting any pain or tenderness. Is there any?
No.
All right, there's no edema or any lesions present. His eyelashes are turning away from the globe, and they're equally distributed. There's no discharge noted on the patient's eyelashes. Can you open your eyes for me? There's no enlargement of the lacrimal glands. His sclera appears to be white bilaterally. His irides are nice and round. They're equally dark brown in color. His pupils are 3 millimeters round, and they're both equally round in diameter. If you could please look up for me. His conjunctiva looks nice and pink and moist with no foreign objects, no discharge noted. All right, and the next test that we're going to perform on the patient is we're going to perform a cotton wisp test, which tests cranial nerve number 5. If you could look up. All right, note that the patient blinked and his cranial nerve number 5 is intact. All right, the next test that we want to perform is we also want to note that the patient doesn't have any ptosis or any fasciculations or tremors to the eyelid area. If you could look forward for me, please. All right, great. Noting that bilateral pupils are reactive to light. If you could please look at that picture on the wall and then look here at my pen light. Notice that the patient's eyes, the pupils both constrict bilaterally, and they accommodate looking at an object closer to the patient's face. All right, the next test that we're going to perform is the corneal light reflex test. You want to look at that picture on the wall. We want to note that the reflection of light is equal bilaterally at the same spot on each eye. So there isn't any strabismus noted, but if there is a potential for strabismus, we could also use the uncover test and have the patient focus on an object in the room and cover one eye. And when we uncover, if there's any abnormal eye movements, then we will know that strabismus is present in that eye. The next test that we're going to perform is the 6 cardinal fields of gaze. We're going to have the patient follow my pen light going in an H. This tests cranial nerves 3, 4, and 6. And there is no abnormal eye movements noted, no strabismus or nystagmus in this patient. The next test that we want to perform, we want to use the otoscope to view the inner eye. We're going to have it on a 0 setting, and we would use a minus setting for a patient with myopia, and a patient with hypermyopia, we would use a plus. All right, what we're going to do is we're going to start about 30 centimeters from the patient's face. If you could look straight, please, noting that we have a positive red reflex. We're going to go on ahead and move into the patient's eye. If you open up a little bit. All right, noting that the retina is nice and orange looking, the vessels are not narrow, there's no hemorrhage present, the disc is sharp and well defined, and if you could look directly at the light, that way we can assess the macula of the patient's eye. Great. All right. The next test that we want to perform is we want to assess the anterior chamber of the patient's eye. Have the patient look directly forward, and you shine a pen light into the patient's eye, noting the depth of the iris, whether it is narrow or shallow or deep would help determine if the patient has a potential for having glaucoma. The next test that we want to perform on the patient is we want to look at the patient's ears, inspecting and palpating for any lesions, nodules, or edema. Is there any pain or tenderness present?
No.
All right, we want to draw an imaginary line from the inner canthus of the eye, ensuring that the auricle is at or above, noting that the patient has normal placement of the ears on the head. The next thing that we want to do is we want to inspect the patient's inner ear canal, as well as the tympanic membrane. All right, we're going to pull the pin up and back, and we're going to look into the ear canal, noting that there's hair present and a small amount of cerumen, and it's nice and pink. And the tympanic membrane is nice and translucent, pearly gray. The bony landmarks are present. We have a cone of light at about 7 o'clock, and no perforations noted. And we would perform that same test on the other ear for a full assessment. All right, the next test we want to perform on the patient is we want to do the Weber test, and we're going to assess the patient's hearing. And since he's been answering questions adequately, we don't suspect that there's any hearing loss. What I'm going to do is I'm going to hit this tuning fork and put it on the midline skull. Tell me if you can hear it out of both ears or just one.
Both.
All right, great. There's no unilateral hearing loss on this patient. The next test we're going to perform is the Rhine test, and we're going to hit it and test his air versus bone conduction. Tell me when you can no longer hear.
No.
Tell me when you can no longer hear.
No.
All right, great. His air conduction is twice as long as his bone conduction, so this is a positive Rhine test. The next test that we're going to perform is the whisper test. We're going to have David occlude his right ear while I whisper a series of 3 numbers or letters, and I want you to repeat them back to me.
6H10.
All right, great. All right, so we know that David can hear very well. The next test that we want to perform is on his nose. We want to inspect and palpate, ensuring that the color is the same color as the rest of his face, that there's no swelling, lesions, or masses. His cartilage, there's no deviation. It's midline. Is there any pain or tenderness in the nose?
No.
All right. We also want to check for the patency of the nares by occluding one, having the patient breathe in and out and let us know if there's any difficulty breathing. No?
No.
All right, great. The next test that we're going to perform is we're going to look into the nasal cavity as well as the septum. All right, we're going to take a look in there, noting that there's hair. There's a small amount of clear drainage. It's nice and pink and moist. We're able to view his turbinates, and there's no perforations noted on the patient, and we would perform that on the other nair during a full assessment. All right, great. The next thing that we want to assess is the patient's frontal and maxillary sinuses. We're going to palpate below the bony brow for the frontal sinuses. Is there any pain or tenderness?
No.
All right, note that there's no swelling also. All right, and his maxillary sinuses, we want to palpate below the zygomatic process, noting any pain or tenderness or swelling. Is there any pain or tenderness?
No.
All right, great. The next thing we want to do is we want to assess the patient's mouth, noting that there's no dryness, his lips are the adequate color for his skin tone, there's no ulcerations or lesions on the outer mouth. If you could please clench your teeth and smile for me. All right, this tests cranial nerve number 7. Also, it identifies any occlusions on the patient's mouth. Will you open your mouth for me, please? We want to note the integrity of the teeth, noting that they're all there. There's no abnormal findings within his teeth. No. All right, and we want to pull his lips back and look at the gingiva to note that it's moist and pink with no ulcerations. No lesions present, no redness or edema. All right, if you could please stick your tongue out for me and move your tongue side to side. This helps to test cranial nerves number 12, and it is intact. If you could please stick your tongue out for me. We want to go on ahead and view the tonsils and the posterior wall of the pharynx, noting that it's pink, smooth, and glistening. All right, and the tonsils are a +1. If you could please say ah.
Ah.
All right, and this test for the soft palate, it has slightly raises, as well as the uvula stays midline, letting us know that cranial nerves 9 and 10 are intact. And the last test that we would perform on the patient is we would elicit his gag reflex with utilizing a tongue depressor, letting us know that cranial nerves 4 and 5 are intact. That is it, and thank you for watching my video.